Hey everyone, welcome back to my YouTube channel. If you're new here, kindly consider clicking that subscription button, and if you're a returning subscriber, thank you very much for always clicking in. And don't forget to share, like, comment. Don't forget also to turn your notification bell, because every time I post a video, you will be the first person to be notified. So whatever I want to talk about is something that is related to what I saw or what I have been dealing with in the hospital. I want to talk about preeclampsia, and that is hypertension in pregnancy. Yeah, that is what I want to talk about. And before I talk about it, let me advise those who are planning to get pregnant or those who are already pregnant. Please, if you are going to you are starting your antenatal clinic, make sure you go to a hospital that is well established, hospital that has that deal I mean hospital that has all the equipments, hospital that people who are working there are not even experienced, but know what they are supposed to do or what they are doing. The reason why I'm saying this, somebody is having preeclampsia or hypertension in pregnancy, and you want to diagnose this when you are in maternity. The time this mother is coming to labor is when you are diagnosing eclampsia. Eclampsia cannot just come without preeclampsia. Preeclampsia will start, and then eclampsia will come as a complication of preeclampsia. So when you are attending your clinic, make sure you go to a clinic that everything that is being done there, or what they are doing, they know what they are doing. There are some private hospital, not even hospitals, clinics. There are some private clinics where they are attending to mother, and they don't take blood pressure, and that is very, very important when you are caring for someone who is pregnant. You can't manage a mother who is pregnant without taking high blood pressure or without measuring the blood pressure. That is wrong. So when you are going to clinic, if you go to that clinic for the first time and they did not take the blood pressure, don't go back there again, because you are putting yourself and your baby at risk of complications. So another thing that you must be keen of is antenatal profile. This is they will take blood, urine. Antenatal profile entails urinalysis, HB, VDRL, that is the syphilis and those gonorrheas, and also another thing that is contained in HIV status, blood group, and results. So those are things that are very important when you are starting to attend your clinic, yeah, or when you are continuing with their clinic. So if you're pregnant and this thing has not been done to you, or this investigation has not been done to you, please go to a hospital that has all the equipment and they can do all these things. There are certain cases where you go to those clinics, they guess your blood group, they guess your rhesus factor, they guess even HIV status, they guess even your blood pressure, they guess everything. And when you are about to deliver, you find that you are having a lot of complication, and that is not right. Yeah, that is not totally right. So what I want to talk about today is preeclampsia. So preeclampsia is a serious medical condition that occurs about midway through the pregnancy, and it can occur after 20 weeks. That is why I'm saying it is always very important to check your blood pressure. So people with preeclampsia experience high blood pressure, protein in urine, swelling, headache, yeah, swelling, headache. Also another thing that they can experience is blurred vision. They are not able to see very well. So this condition need to be treated by a healthcare provider. So it typically goes away after your baby is delivered. So most of these preeclampsia, sometimes you find that somebody had hypertension, because Africans, they don't go to the hospital, they don't check their blood pressure until something is wrong, is when someone can maybe go to the hospital. So you find that most of the time, not every time, but most of the time, you find that somebody was suffering from hypertension and was not aware. And you know, hypertension is a silent condition, or is a silent killer. So you find that pregnancy will trigger the symptoms, and this is where sometimes you can you will be able to, or the healthcare provider will be able to identify it when you are pregnant. So when you are pregnant and you have been diagnosed with hypertension, that is what we call preeclampsia. And I said it presents with high blood pressure, protein in urine, and protein in urine will only be identified when urinalysis has been done. Also, another thing that will be identified is you are not able to see well, blood vision, and swelling. Not when you are pregnant, sometimes the swelling of the lower limbs is considered normal, but when it reaches at times that you are swelling, even your face, your hands, your whole body is swelling, then just know that something is wrong and you need to do something. So let's talk about who is at risk of getting preeclampsia. Preeclampsia may be common in first time mothers. So if you you're first time mother, or if you're a preemie, because first time mother, we always call them preemie, and you are not diagnosed with preeclampsia, in the subsequent pregnancy you are not likely to get it. So it is mostly common in first time mother, and healthcare providers are not entirely sure why some people develop preeclampsia. So there are some factors that may put you at risk of getting preeclampsia. Number one, history of high blood pressure. If you are previously suffering from blood pressure, I said most of the time you will have or will suffer from preeclampsia. If you have a kidney disease, or if you are a DM patient, you can also develop preeclampsia when you are pregnant. Another point is that those who are expecting multiple or expecting multiple pregnancy or multiple babies, or those who are carrying more than one baby, they are also at risk of developing preeclampsia. Also, if you have a family history of preeclampsia, you are also likely to get preeclampsia when you are pregnant. Another group of people are those who are obese. Obesity is at risk of all the conditions that sometimes this medical condition. Obesity is the most common risk factors of most of all medical conditions. If you get a DM, if you are obese, you are at risk of getting DM, you are at risk of getting hypertension, you are at risk of getting any other medical condition, or any other conditions that can complicate your life. So obesity is one of them. Also, if you have some autoimmune condition, you are also at risk of getting preeclampsia. And also there is another point that is always I always wonder why, because they do not give the clear reason about it. If you are somebody who usually get pregnant with the different partners, the first person you got pregnant with with a different man, the second pregnancy was not for the same man, like that, you are also at risk of getting preeclampsia. Those are some of the risks. Let me see if I can add others. So we also still have some of the risk factors. I think I say diabetes mellitus is one of them. Heredity for moles is also another one of it. We have also multiple pregnancy and primigravida. I said that. We also have obese mother. I've already said about it. I think those are some of them. So let's look at symptoms of preeclampsia. Let us look at symptoms of preeclampsia, and we have the three cardinal signs. Three important signs that when you notice in a mother who is pregnant, then just know that this mother is having preeclampsia. Number one, hypertension or high blood pressure. Number two is edema, general body edema. And number three, protein in urine. Protein in urine, edema, and hypertension. Those are the three cardinal signs of preeclampsia. If you did not know, now make sure you are aware. Apart from three cardinal signs, we also have mother will present with shortness of breath, right side of abdominal pain, blood visions, or sensitive to light. Yeah, those are some of the, and also headache. Yeah, headache. I'm forgetting about headache. Those are some of the signs and symptoms of preeclampsia. So it is essential to share all your pregnancy symptoms with your healthcare provider. Yeah, you tell them what you feel, how you feel, and how how things are going on. So severe preeclampsia may include symptoms like hypertension, which is 160/110 or higher. That is severe preeclampsia. And it can also show signs of decreased kidney function, fluid in the lungs, and low platelet level. Those are some of the symptoms, and also oliguria, low production of urine. Those are some of the causes of symptoms of severe preeclampsia. And remember, we have three types of preeclampsia. What do I mean? We have mild, moderate, and severe. That is why I was talking about the three cardinals, the severe symptoms of eclampsia. Yeah, we have the mild, the moderate, and severe. So how do you know that these symptoms or this mother is in mild form of preeclampsia? So when a mother is, or when you are classifying this preeclampsia, mild symptoms, mild classification of preeclampsia. This is detected when after resting, the diastolic pressure is 15 to 20 above the normal blood pressure. Yeah, diastolic pressure. You already know what I'm talking about. The diastolic pressure is 15 to 20 above the normal pressure. So moderate preeclampsia is when this is diagnosed when there is marked rise both diastolic and systolic. If there is an increase, mild, only diastolic will be increasing, but moderate, there will be increasing in moderate in systolic and diastolic. Yeah, the systolic pressure and the diastolic pressure. Yeah, that is what I'm talking about. And then severe preeclampsia the pressure will be 160, the systolic be 160 and above, and the diastolic be 110 and above. That is when you will say this person is having severe preeclampsia. So let's look at some of the effects of preeclampsia to the mother and to the fetus and how it can be managed. Yeah. So effects of preeclampsia to the mother. Number one, we have placenta abruption. I will talk about placenta abruption in pregnancy series. The condition may worsen, leading to even eclampsia. So the mother can complicate to eclampsia. And also the kidney, lungs, the heart, liver may be seriously damaged. Those are some of the complications. And also the eye or the mother can become blind. Those are the effect of preeclampsia to the mother. Effect of preeclampsia to the mother. So effect of preeclampsia to the baby. We have a low birth weight, because most of the time you find that this mother usually go to labor early. We also have hypoxia during prenatal and intranatal period. Yeah, intranatal period. Also we can have placenta abruption leading to hypoxia and also death of the fetus. We say prematurity because they usually go to labor early. So management I will not talk about, because even if what I think was very important, maybe the signs and symptoms, those who are at risk, so that they go and check before the condition is worse. Yeah, those are at risk. And also classification. I think those are things which are very important that I say I'm supposed to talk about, because it is not only medical people or medical student are the people watching this video. I know someone who is not in the field of medicine is also watching this video. So if I'm talking about management, I think it won't help them, but those who are in medical field already know what they're supposed to do. Because if someone is, let me just highlight what is supposed to be done. If someone is, you diagnose a mother with preeclampsia, you ensure first thing, you ensure bed rest. Number one, you ensure bed rest. The midwife play an important role in detecting preeclampsia. That they remember that. So there should be always a vigilant antenatal care to enable early detection and management. So you should also ensure you take a thorough history to detect the mother who is at risk if you are taking mother through antenatal care, and you should follow up so that they don't develop complication. So the method of management will depend on the severity of the condition. Remember, I said we have mild, moderate, and severe. Yeah. So I said, and I also said, you ensure that you provide adequate rest and monitoring the mother and the baby. Yeah. So and also ensure you prolong the pregnancy until the baby is mature, so that the baby can survive when the mother delivers, and you ensure you safeguard the life of the mother. Yeah, you safeguard the life of the mother. Severe preeclampsia, if the pressure has refused to be stabilized, or if you have tried to stabilize the pressure and it cannot, then the best way to manage this mother is to just deliver the mother, even if they deliver the baby, even if the baby was still young. We have other managements that will be managed medically, and also a nursing care, where we will be the patient will be given hypertensive drug, anticonvulsant drugs, and also sedative drugs. Yes, and other nursing management, the monitoring the mothers, the mother condition, the fetus condition. You take the vitals, you ensure food that is low in salt and the food that is low in salt and low in protein, because remember this mother is having protein in urine. So if you overload the mother with protein, you will worsen the condition. You ensure hygiene. Those are things that as a nurse or as a medical provider, you already know what you are supposed to do, because I say that you manage it medically and other nursing responsibilities. Like you will let me repeat, you give sedatives, you give anticonvulsant, and you give antihypertensive drugs. So, and those other medical management, or so that is what I will stop there. And remember this preeclampsia can complicate to eclampsia. So eclampsia is a complication of preeclampsia. So eclampsia is a complication of severe preeclampsia, and it is characterized by convulsion and coma. You remember the other signs and symptoms that I said, the cardinal signs, and now in this eclampsia, the mother will have convulsion and the mother can go into coma. Yeah, those are some of the things that I can talk about there. And remember, when this mother is convulsing, we have the stages. We have 4 stages of preeclampsia. We have premonitory stage, we have tonic stage, we have chronic stage, and we have coma. Yeah. So we have differential diagnosis of preeclampsia. What do I mean by differential diagnosis? Some conditions can be missed, or someone can misdiagnose eclampsia with a certain condition. Number 1, epilepsy, cerebral malaria, meningitis, head injury, cerebrovascular accident, alcohol intoxication or poisons intoxication. We have drug withdrawal, metabolic disorder, water intoxication, encephalitis, hypersensitivity, encephalopathy, and hysteria. These conditions can be misdiagnosed as preeclampsia. Yeah, so make sure you know the cardinal signs of preeclampsia before you diagnose a mother with a preeclampsia. Yeah, so that you don't mismanage the patient because you forgot or something else. Yeah, I think those are the things that I would like to talk about today. So I think I will stop there. So make sure you watch my content, pregnancy series. We are continuing, and let's meet in the next video. Bye till next time.